Welcome back. Artificial intelligence, it's moving fast in healthcare, but can clinicians trust it?
Yeah, that was the real big question at Hartford HealthCare's first ever AI summit earlier this week. Experts from all across the nation gathered there to tackle the promise and risk of AI in medicine. Joining us to tell us more this morning, Dr. Barry Stein, Vice President, Chief Clinical Innovation Officer, and Chief Medical Informatics Officer at Hartford HealthCare. Sir, thank you so much for being with us. Let me start right here. Can you start by telling us what are the most exciting highlights from that Hartford HealthCare AI Summit that you just had?
Morning. Really excited to share how our summit a few days ago highlighted what's happening in Connecticut for our residents, as well as beyond around the world, right at Hartford HealthCare. And it's all about how we are unlocking the full potential of AI for our patients in a safe and secure way. And we've done that by building different capabilities, which we highlighted, one of which is partnering with the world's best to do research, to do education, as well as to develop the data security that we need to do this kind of work.
Very interesting. And you talked about partnerships. So how do you think that Hartford Healthcare Center for AI Innovation in Healthcare is really leveraging, utilizing its many different partnerships to drive real-world AI solutions?
Yeah, and we've developed these partnerships over the last 10 years, understanding that no one entity or organization can do this alone. There are too many complex dimensions and skill sets. So, for instance, in academics, we've partnered with MIT and Oxford University to do real cutting-edge research to really take these ideas and impact our patients. We've partnered with Google to allow us to develop a data layer platform that keeps our patients' information secure and at the same time allows us to unlock the full potential of that data.
Doctor, since this
And then,
I'm sorry, Doctor, I was going to ask, since this AI technology is so new, it's changing every day, how can you make sure it's going to stay safe and patient-centered?
at Harvard Healthcare, quality and safety is front and foremost. We're recognized for that. And at Hartford HealthCare, we've developed a governance layer in the organization, and we treat AI much like we treat a new drug coming into our enterprise or our new device, with extraordinary rigor and discipline to make sure that before it even begins to get near a patient, that our safety practices have been employed to protect our patients
Oh, yeah.
against any kind of unintended harm.
Wonderful to hear. And lastly, as we quickly wrap up here, obviously it's important to ensure that their safety, the security is in place. But what about the patient care? How is this going to help patients and their care that they receive through Hartford HealthCare?
Yeah, I can give two examples, the one of which is our 24/7 offering to our community, where you can get care 24/7 just on your app. But it really is AI powered initially to provide efficiency and allow us to see many, many more patients that we otherwise could. That's with our startup partner, Care Health. And the other one is our imaging partner, ADOC, to allow us to be able to pick up really critical imaging abnormalities in the emergency room very, very quickly, that we can then intervene appropriately very, very quickly.
All right, Dr. Stein, we appreciate it. Thank you.
Thank you.
Thank you.
We will be right back.